Good afternoon, I'm Drew Holley with BIS. We are going to talk a little bit about HMO, Health Maintenance Organization. What does this mean? What does it not mean? In the old days, HMO could have been a very scary terminology. When I say old days, depending on your generation, that could be, early 90s, 80s, even late 90s. HMO, a lot of people cringed at that because it would really restrict you on less doctors that you could go see and your insurance would cover. And there used to be, and for the most part this has gone away, at least here in the state of Georgia, you had to get a primary care doctor. And even if you knew you needed to go see some specialist like a dermatologist, and you knew you had the problem that was related to a skin disorder, you weren't allowed contractually to go to that doctor. You had to go to your primary care, waste the time, have a primary care copay, then just to hear, yes, I'm gonna go get a referral to a skin doctor, okay? That was kind of the old HMO. A lot of that is pretty much gone. In fact, I've been doing this almost 20 years. It is extremely rare, and BIS for the most part wouldn't sell anything because the carriers have kind of gotten the message on that a lot of consumers or businesses don't want to be told you have to go see a primary first in order to go to a specialist. So that's very important generationally if you're listening to that. A Simple Pro and HMO tends to be a lower price than maybe a PPO. And that's just because in the game of negotiation between an insurance carrier and all these doctors, generally speaking, an HMO, the carriers won. They won because they got those doctors or facilities to agree to doing their services maybe on a lower amount. And so therefore, because they agreed to do their services for a lesser amount than maybe a doctor in a PPO network, they can repackage the pricing to a small business and say, hey, it could be a lower rate. So Pro could be lower. A con could be there could be less doctors. That is not as prevalent as it used to be. In fact, in Metro Atlanta, you could have mainline insurance carriers offering small group plans where the same doctors and hospitals you want in network are all in network in an HMO or PPO. And there could be scenarios where there's really no difference other than an HMO will not cover out-of-network benefits. So that is a big deal, but is it really a big deal? And that's something you should talk to your advisor, because the number of claims that get filed out of network that really shouldn't be, or just from an education standpoint. So we are not as afraid of offering HMOs as maybe 20, 30 years ago, and a good choice is just maybe offer your small group an HMO and a PPO plan, or an HMO and a point of service, and a good advisor would be able to do that. So thank you, I'm Drew Holley.